talk us through some of the health conditions that you frequently diagnose when examining somebody's skin.
So one that people often don't think about is actually thyroid disease. And even though the thyroid is such a great regulator of all our hormones and our metabolism, interestingly, when your thyroid is off, one of the first things you can sometimes see is changes in your hair, where you can get thinning, you can get a loss of the sides or lateral aspects of your brows, as you know, you can get different kinds of dry skin rashes. And sometimes people don't even realize that this may be a thyroid related thing. They think, oh, I'm just having a little eczema or an allergy. You can certainly sometimes even see just a subtle bulging of people's eyes. You can see changes in their nails. So there are a number of skin and kind of dermatologic manifestations where thyroid disease might present that way.
What's another common condition you often encounter?
So another one is anemia, and that's when someone doesn't have enough red blood cells or there's a problem or dysfunction with their red blood cells. And similarly, when you walk in and you see someone and their hair is thinning and their nails are maybe brittle and they're talking about texture changes, they may look a little pale to you, that's another good reason to go get a blood test.
And as we always say, that if you have a change in your skin and you notice it and it lasts several weeks, is not getting better, then that's your call to go see your physician and probably best served seeing a dermatologist. But I want to end on this, Dr. Batra, asking you, what's the illness you see the most in your dermatology practice?
The illness I see every single day, sadly, is skin cancer. And we really are having an epidemic of it. It's the #1 cancer of any type in the United States right now. It's more than lung, breast, colon, and prostate cancer combined. Wow. And what I tell my patients is that what you may think a skin cancer looks like is not always the case. So you're absolutely right on, Drew, that people should be checking themselves, because the far and away most common skin cancer, basal cell, isn't a brown spot like what we think of. It's often like a pearly pimple that's just not healing. It's not even necessarily pigmented. So I think your point is so well taken. I tell my patients, just get in the habit, pick a day once a month, whatever is easy for you to remember. Give yourself a good head to toe. Like you said, if something doesn't look right, if it's lingering for a month, then that's a really good sign. If it's still there, the next time you scan yourself, maybe then a medical professional should evaluate it and can help you get it diagnosed.
And for those places that you can't see yourself, find yourself a skin buddy that can take a look on your back, etc. And anything you've had the last weeks, make sure you go see your doctor. And Dr. B, as always, great information. Thank you for joining us today.
Thank you so much for having me. Great to see you, and thanks for getting the word out. Thanks for sharing the information.